Today's NHI chat features Dr. Harlan Vanterpool, NHI's medical director. Today's topic, breast cancer.
So we've already crossed over 50 persons being diagnosed with cancer for this year, and of those, almost 20 of them are breast cancer.
Is this alarming? Is this average or above average?
Well, when I think about the context of the Caribbean region, I don't think it is, because what we're finding is that there's a steady increase in the prevalence of cancer throughout the entire region. And as a matter of fact, they expect cancer is going to surpass even diabetes as one of the number one causes of morbidity and mortality in the region relatively soon. So as it stands, I would not say that we have an undue or over prevalence of cancer here. However, it's alarming to us because it's beginning to hit us more and more, and the persons that are presenting with advanced breast cancer are becoming younger and younger. So I think it's concerning to us all. Getting the message out is very important. We have a number of awareness initiatives. We have the Cancer Society and we have Breast Cancer Awareness Group, etc., etc. And they're all doing a very good job, getting the message out as to. However, just getting the message out and getting people to actually respond to the message are two different things. What we find is that, and I do it with my clients as well, whenever I ask, have you done your self-breast exam? Are you doing your annual clinical breast exams? Are you doing your screening mammograms? The answer oftentimes surprises me. Most women are not doing regular self-breast checks. And a number of persons don't have necessarily an annual physical where they do a clinical breast exam. And what I'm finding as well is that many women, even though they're at the age for breast cancer screening, they're not necessarily having their annual mammograms done. So this is a concern, because even if you're hearing and there's awareness, if you're not actually making an active move to do these things, then you cannot get early diagnosis. And this is what the trend that I'm seeing here, is that most persons that are being diagnosed with breast and other cancers are being diagnosed in advanced stage rather than at stage 1 or 2. You should know your body well. And basically what I'm saying is that you should have no fear about examining your breast tissue for what you feel that is something irregular or it should not be there. So you're looking for lumps, you're looking for nipple changes, you suddenly notice that your nipple has a different shape to it normally does. It's maybe retracted or something like that. These are the things that you're looking for. So you're looking for obvious physical changes and changes that you feel sense with the fingers and the fingertips. So the clinical breast exam is just done by a clinician rather than you doing your own exam. And the key to clinical breast examination is this. One, you should have a clinician that is probably very familiar with you, and that clinician has done or is your regular doctor. That's because that clinician will tend to know your history best, and that clinician may be able to pick up changes a little bit easier than somebody else who's not as familiar with you. And a clinical breast exam is usually done in the context of an annual physical exam, and oftentimes is a precursor to having your screening mammogram. So when you go for that check, you do the self-breast exam, the clinical breast exam, and then your doctor may request for a screening mammogram to be done, and then of course you follow up and ensure that that screening mammogram has gone well. Your physician should guide you as to what is expected in terms of your health checks, especially for your age. Once you pass the age of 40 in the BVI, or especially in the Caribbean diaspora, I would suggest that a self-breast exam and a clinical exam be a part of mandatory examination of your patient. So it all depends on the age bracket as well, what you would allow to guide you in your annual physical and full comprehensive examination. So again, you have to be guided by what's expected health-wise, especially for those age ranges, and your doctor should advise you as to what you should and shouldn't, or what should make up your overall health examination for the year. I would just like to again congratulate the agencies such as the BVI Cancer Society and the Breast Cancer Awareness Group for continually highlighting the importance of being aware. And also remember that there are a number of other cancers that are also prevalent in our community, and those as well should be highlighted as well. So I would like to continue to encourage the persons that are out there doing such a marvelous job in promoting, and to you, the general public, I just want you to recognize that cancer is on an increase in the BVI, and therefore it's your prerogative to ensure that you do your annual physical examinations, you're doing your necessary screenings, and you take charge of your health overall.